Greetings. This is episode 7 of EdgeIgniter, titled Techniques for Enhancing Decision-Making Under Pressure. I am Alex Rivers, and in this concise session, we will explore evidence-based methods to improve decision-making during high-stress scenarios, such as crises or tight deadlines. These periods often trigger impulsive responses due to heightened stress hormones, which can impair executive functions and shift behaviour toward habitual rather than goal-directed actions. By adopting structured techniques, individuals can foster clarity and resilience. We will cover 3 key approaches with elaborated details and vivid practical examples. First, implement a deliberate pause to analyze before acting. This technique entails intentionally halting immediate reactions to allow for physiological and cognitive recalibration. Begin by recognizing the onset of pressure such as accelerated heart rate or narrowed focus and initiate a controlled breathing sequence. Inhale deeply for a count of 4, hold for 4, and exhale for 4. This process activates the parasympathetic nervous system, countering the fight-or-flight response and restoring access to rational thinking. The benefits include reduced impulsivity and enhanced evaluation of options, as research shows that such pauses mitigate prefrontal cortex oppression under acute stress. For a vivid example, envision a senior executive in a bustling conference room during a critical merger negotiation. As the opposing team suddenly demands a 20% equity increase, causing the room to tense with urgency and raised voices, the executive pauses for 10 seconds. She closes her eyes briefly, breathes steadily, and mentally lists the facts, the company's valuation data, potential alternatives, and long-term implications. This prevents a hasty agreement that could erode shareholder value, leading instead to a counterproposal that secures favorable terms. Second, apply the OODA loop framework, which stands for observe, orient, decide, and act. This iterative model, originally developed for military contexts, promotes systematic processing in dynamic situations. Start by observing, gather raw data from the environment without bias. Then orient, analyze this information in the context of prior knowledge, resources, and potential risks. Decide on the optimal course based on this synthesis, and act swiftly while preparing to loop back if conditions change. This approach enhances adaptability by breaking down overwhelming scenarios into manageable cycles, countering stress-induced cognitive rigidity. Consider a project manager in a high-tech firm facing an abrupt system outage during a product launch event, with clients waiting impatiently in a crowded auditorium and error alerts flashing on multiple screens. She observes by scanning logs and team inputs to identify the root cause: a faulty server update. Orienting, she weighs options like a full reboot versus targeted fixes, considering downtime costs and audience retention. She decides on a partial rollback, acts by instructing the team, and monitors for adjustments, ultimately restoring service in under 15 minutes and salvaging the event. Third, seek diverse perspectives to challenge initial assumptions. This method involves proactively soliciting input from varied sources to broaden viewpoints and mitigate biases amplified by stress. Identify stakeholders with differing expertise or backgrounds, pose open-ended questions about the situation, and integrate their insights to refine your judgment. The advantage lies in reducing tunnel vision and groupthink, as studies demonstrate that diverse inputs reveal overlooked variables and foster more robust outcomes. Picture an emergency room physician during a chaotic night shift, treating a patient with ambiguous symptoms amid blaring alarms and a surge of incoming cases. Instead of relying solely on her initial diagnosis of dehydration, she consults a nurse with frontline experience and a radiologist via quick video call. The nurse notes subtle behavioral cues suggesting infection, while the radiologist highlights scan anomalies. This collaboration shifts the treatment plan to antibiotics, averting a potential complication and ensuring the patient's swift recovery. In conclusion, enhancing decision-making under pressure requires intentional practices like deliberate pauses, the OODA loop, and diverse perspectives. Start with one technique in your next challenging situation to build proficiency gradually. Thank you for joining this episode. The next installment will address strategies for cultivating long-term resilience. Until then, apply these methods with deliberate focus. The content presented in this podcast episode represents my personal opinions and is intended for informational purposes only. It should in no way be considered a substitute for professional advice from qualified experts, such as psychologists, therapists, or other licensed professionals. Always consult with appropriate specialists for personalized guidance on matters related to mental health, self-improvement, or any other topics discussed.